So CLEERLY works by starting with a CT angiogram, which has already outlined a plaque in the arterial wall. So just to define a plaque, plaques don't exist in the lumen or the center part of a vessel. They actually move into the walls of a vessel. So as cholesterol moves into that wall of the vessel, that vessel wall begins to bulge out into the center of that blood vessel, and it can restrict flow further down the line. So that oftentimes doesn't lead to severe disease. It can limit you in many ways in that your muscles are not getting enough blood, but it doesn't typically cause an immediate event. It's a slow process to accumulate a plaque. The body can actually bypass that by building a vessel around it, and it picks it up, and as it picks that up, and this is happening slowly, the body can correct for this. The issue occurs when the skin over that plaque is so thin that it ruptures. And if that ever does, the body will immediately form a clot, thinking that there's a hole in a blood vessel and it's going to prevent you from bleeding to death. But formation of that clot completely blocks the vessel. So anything downstream does not get any blood. And if that's brain, it's a stroke. And if it's heart muscle, that's a heart attack. So this is the model that we have to understand how vascular disease, heart disease, strokes all work. And that may be more important than even knowing that you have plaque. Well, the body will actually add calcium into those plaques to stabilize the plaque. Like we put calcium in bone and it makes the bone stronger, we put calcium in those plaques and they're much less likely to rupture. So we have the study now called the CT calcium score, which I hope many of you have had, and that really for us tells us whether or not there is plaque formation in the wall of your vessel, and if there is, we know you have atherosclerotic disease, whether that might be heart or brain or somewhere else, but that's how we determine that, and that might be one of the elements that we use to decide whether or not you would be placed on a statin. It can then grade the plaque. It's a fibrous plaque. A fibrous plaque is less likely to rupture because it has these fibrous elements, kind of like looking at a grapefruit and seeing little sections in between the pulp, but the CLEERLY can also pick up fibrofatty plaques, which are a combination of the fibrous part, but a lot of excess fat. These plaques are much less stable, much more prone to rupture. So the CLEERLY can actually tell you an assessment of what we might do next, which could be something very invasive, like a cardiac catheterization, or maybe even move to something like a coronary artery bypass grafting, what we call a cabbage in the vernacular. But that's when you get your sternum cracked open, spread apart, take vessels out of your legs, out of your chest wall, replace the existing vessels by bypassing them. So a very invasive procedure, and generally done with good reason to do as a life-saving procedure. But it would be really nice to know going in that this was exactly the procedure you needed, exactly which vessels were involved, and CLEERLY provides so much more data than we've been able to ascertain up to this point. So it's a huge addition in the evaluation of cardiac disease, and it is much, much less invasive than what our current technologies include, which are cardiac catheterization and, again, cracking your chest open. So having this data point is huge for me in my practice. We're very happy to be able to offer CLEERLY as one of the few people in the city who are currently doing this. Technology is relatively new, but I feel it's very well validated, has very few downsides and a great upside.